So a while ago, we started noticing some changes in my dad's memory and behaviour. As his family, we knew that something wasn't quite right and we wanted some answers. So we went to his GP, who ran some standard cognitive tests, things like recalling addresses, solving simple math problems. However, my dad had been a taxi driver for over 15 years and he'd spent every day calculating fares and remembering street names. So of course he passed that test pretty easily. The GP told us at the time he didn't meet the criteria for dementia or Alzheimer's, but we weren't convinced. We explained his background and we shared some of his, well, basically some of our concerns. For example, my dad didn't recognize our family car, which was a car we'd had over 6 years and he traveled in it regularly. But still, the GP wasn't able to offer any further support through the NHS. And thankfully, we had WPA health insurance and it meant we could request a private referral to a neurologist. The private specialist took a much different approach. He ran more detailed assessments, including an MRI, and the results confirmed what we feared, that Dad was basically in the early stages of Alzheimer's. However, because we caught it early, it meant we could take action, from accessing medication that only specialists can prescribe, to making small changes that helped him stay independent for longer. Getting that second opinion, it changed everything, gave us clarity, meant my dad could get the care that he really needed, and not just what the system allowed for. So having private medical insurance didn't just speed things up, it gave us access to specialists, proper testing, and ultimately a diagnosis that we wouldn't have had otherwise. That made all the difference, not just for my dad, but for all of us as a family. And it's part of the reason why I now do what I do, to help others access the same care or the same type of care when it matters most.